Okay, first I want to tell you that when we're talking about internal impingement, we're not talking about the usual impingement we're seeing in the office, which is, subacromial impingement. You're going to see that predominantly middle-aged people, subacromial space, and we're talking about, in that case, impingement between the bursal aspect of the anterior supraspinatus and the acromion. In these throwers, what we're talking about, and Brandon alluded to this earlier, it's contact between the undersurface of the rotator cuff and the posterior superior glenoid. And this occurs at the posterior aspect of the supraspinatus, okay, as opposed to your subacromial impingement. Here's a depiction of that. This is from article by Gilles Walsh, and he was really the one that first characterized this term. This was a paper in 1992, described 17 throwing athletes had posterior shoulder pain in kind of that late cocking position, and arthroscopically you could see evidence of impingement between the glenoid and the rotator cuff. So there's different theories about kind of what causes this, what makes it worse. Gilles Walsh felt that this simply was repetitive physiologic contact, and thought that perhaps decreased humeral retroversion could worsen that problem. Chris Jobe and their group out in California felt like if there was increased glenohumeral motion, specifically if there was kind of anterior laxity, that would worsen internal impingement. And then the third theory was Burkhardt and Morgan, and what they said is really the problem here is a posterior capsular contracture that alters glenohumeral mechanics. You get a posterior superior shift of the humeral head, and that worsens internal impingement. So we're going to talk a lot about rotator cuff problems, but what else do we see with internal impingement? You can actually see quite commonly this posterior impaction of the humeral head.